Hey, my name is PiggyChemist, your AI pharmacy educator. And this is Pody, a pharmacy student, and the real brain behind the research. Each week, Pody researches a health topic, writes a report, and together we turn it into a video. Real Research AI. Today, I'm breaking down Styes. We'll cover what they actually are, how to tell them apart from Chalazion and Blepharitis, whether they're contagious, the one treatment that actually works, why antibiotic drops are usually the wrong choice, when to see a doctor, and how to stop them coming back. Let's start with what a stye actually is. A stye is a bacterial infection of a tiny oil gland on your eyelid. Think of it like a pimple, but on your eyelid, almost always caused by Staph aureus, the same bacteria already living on most people's skin. It gets into a blocked gland, multiplies, and you get that painful red lump. The good news? Most styes clear in 7 to 10 days with the right care. The problem is, most people don't actually know what the right care looks like. There are two types. External hordeolum sits on the lash line, points outward, and is visible like a pimple. Internal hordeolum forms deeper in the meibomian gland, often hurts more, points inward toward the eye, and sometimes needs a GP sooner. Inside your eyelid, there are dozens of tiny oil glands that keep your eyes lubricated. When one gets blocked and bacteria get trapped inside, you get a stye. Knowing this changes everything about how you treat it. How does it feel and how long does it last? It starts as a tender red spot, throbs a bit, the eyelid feels heavy, and your eye might water. It builds up over 1 to 3 days and peaks around day 4. Most resolve completely within 7 to 10 days with consistent warm compresses.
7 days? My patients last about 6 hours, tops.
Before we get into treatment, there are two conditions that get confused with styes all the time: Chalazion and Blepharitis. They look similar at first glance, but they need totally different approaches. Getting the diagnosis right is the difference between 2 weeks of warm compresses and 3 months of frustration.
Not every eyelid lump is a stye. Here's how to tell them apart.
3 conditions get confused all the time. A stye is an acute bacterial infection, painful, short-lived. A chalazion is a blocked gland without active infection, firm, painless, and lasts weeks to months. Blepharitis is chronic lid margin inflammation. No single lump, just burning or irritation that comes and goes. Each needs a different approach. 2 key links to remember: a stye can turn into a chalazion if the infection clears, but the blocked gland stays walled off. The lump gets firmer and painless, but doesn't go away. And Blepharitis actually causes styes over time. Chronic lid inflammation predisposes your glands to block, which is why recurrent styes almost always mean you have underlying blepharitis.
Wait, so my recurring styes were actually blepharitis all along? That changes everything.
This is why same-spot recurrence in older adults deserves attention. A chalazion that keeps coming back in exactly the same place can sometimes be something more serious than a blocked gland. Your GP can refer you to ophthalmology if that's the pattern. Now, the question everyone asks, is a stye contagious? Honest answer, not really. The bacteria that cause styes already live on most people's skin. You can't catch a stye from someone else like you catch a cold. What can happen is you spread your own bacteria from one eye to the other with unwashed hands. That's the main risk. So you don't need to stay home from work, school, or childcare. Just be strict about not rubbing your eyes and not sharing personal items. Here's the practical list. You can go to work, school, and childcare. You don't need to quarantine, but do avoid sharing towels, pillowcases, eye makeup, and eye drops. If you wear contact lenses, take them out immediately, and don't put them back in until the stye is fully healed. Recurrence isn't you catching it again. It's your own eyelid condition. Now, the part most people get wrong: how to actually treat it. Warm compresses are the #1 treatment. They soften the blocked gland, bring the stye to a head, and let it drain naturally. This is backed by actual trial evidence, not folklore, and they beat almost everything else you'll find in a chemist for uncomplicated styes. People underestimate them because they sound too simple to work, but simple is often what actually works. The exact technique matters. Use a clean cloth soaked in warm, not hot, water around 40 to 45 degrees Celsius. Hold it against the closed eyelid for 10 minutes. Do this 4 times a day. After each compress, gently massage the lid toward the lash margin with a clean fingertip to help drainage. Consistency beats intensity here. Here's what the evidence actually says about each treatment. Warm compress 4 times a day has strong evidence. Do this first. Lid scrubs with diluted baby shampoo or commercial wipes are a good adjunct. Antibiotic drops and ointments are not indicated for uncomplicated styes. Popping or squeezing spreads the infection, and tea bags or gold rings have no clinical evidence.
So the gold ring trick is officially useless. I owe my grandmother an apology.
A few golden rules while you're treating a stye. No contact lenses until it's fully healed. No eye makeup, especially no mascara. Do not squeeze, pop, or drain it yourself. Try home treatment consistently for 7 to 14 days before booking a GP. Patience and cleanliness are the whole game here. In practice, a warm compress looks like this. A person holding a soft, warm cloth gently against a closed eye for 10 minutes at a time. No pressing, no rubbing, just steady warmth. Repeat through the day.
No mascara for 2 weeks? I have things to post. This is a disaster.
Now, do you need antibiotic eye drops? Almost always no. Here's why antibiotic drops don't work well for styes. The infection sits deep inside an oil gland. Eye drops just pull in the tear film on the surface of your eye. They cannot reach where the bacteria actually are. Ointments penetrate slightly better but still don't get deep enough to change the course of the infection. Australian and international guidelines say the same thing. Warm compresses are the mainstay, and topical antibiotics are not appropriate for uncomplicated styes. Since many viewers watch from different countries, here's what's available where. In Australia, chloramphenicol drops and ointment are pharmacist only, over the counter. In the UK, it's over the counter. In the US, chloramphenicol is prescription only, so you can't get eye antibiotics without seeing a doctor. Stronger antibiotics like tobramycin or erythromycin are prescription in every country. But remember, availability is not the same as being the right treatment. For uncomplicated styes, none of these are indicated.
Different country, different rules. But the drops still are not the answer. Good to know before my next trip.
There are situations where oral antibiotics do matter. If the whole eyelid is red and swelling is spreading, if you have fever or swollen lymph nodes, or if the infection looks like it's moving beyond the eyelid, that's a GP or emergency visit. In those cases, oral flucloxacillin or cephalexin is standard in Australia and the UK. Doxycycline may be added if recurrent meibomian gland disease is driving things. Your GP decides. Walking into any chemist in Australia, you'll see a wall of eye care products, drops, ointments, wipes. For an uncomplicated stye, most of what's on that shelf isn't what you actually need. Simple, consistent warm compresses do more than any product you can buy. Before we get into the warning signs, I want to be clear about something. Most styes really do just need time and warm compresses, but a small number of them are hiding something more serious, and the difference matters. The next section is the part that keeps you safe when your instinct says something is off. Here are the red flags. Know these and act fast. Screenshot this. No improvement after 7 to 14 days of compresses. See a GP. Rapidly growing stye or the whole lid. Swelling, same day. GP. Fever, spreading facial redness, vision changes or eye pain on movement. Go to the emergency department urgently. Chalazion-like lump lasting more than 4 weeks. GP for possible steroid injection. And same spot recurrence in older adults needs ophthalmology referral to rule out rare but serious causes. The two words you really need to know are preseptal and orbital cellulitis. Preseptal means the infection is in the eyelid only and the eye itself moves fine. Orbital means the infection has moved behind the eye might bulge, and moving it hurts badly. Orbital cellulitis is a medical emergency. Don't wait it out at home, and don't assume it will clear with the same warm compresses you use for a normal stye. So why do some people keep getting styes over and over? Let us get into the real reason. If you're somebody who keeps getting styes every few months, I want you to pay attention to this next section. Recurrent styes are almost never random bad luck. There's usually a root cause underneath, and once you fix that, the pattern breaks. It's one of those things that sounds too simple to work until you try it. If you keep getting styes, here's the real reason and the fix. Recurrent styes almost always point to one of two things: Blepharitis, which is chronic lid margin inflammation, or Demodex, microscopic mites that live in the base of your eyelashes. Yes, most people have some. Treat the underlying cause and the styes stop coming back. Rosacea and seborrheic dermatitis can also contribute, so can long-term isotretinoin use for acne because it dries out the oil glands. A simple daily prevention routine. Warm compress once or twice a day, even when you don't have a stye. Lid scrub with diluted baby shampoo or a commercial wipe every evening. Never sleep in eye makeup. Replace mascara every 3 months and never share it. Clean your contact lenses strictly on schedule. Add omega-3 supplements, 1 to 2 grams a day, which has trial evidence for meibomian gland health. A few special cases worth flagging. Children get styes more often than adults. Warm compress with a soft cloth still works. Babies and toddlers use a warm cotton ball, never hot water, and ask a pharmacist before any medication. Pregnancy, warm compresses are preferred, and chloramphenicol is avoided in late pregnancy. Elderly styes heal slower, and same-spot recurrence needs closer follow-up. Diabetes or immunocompromised, lower threshold for seeing a GP because cellulitis risk is higher. And if you're on isotretinoin for acne, styes and chalazion, will be more common until the course ends. Medication safety notes worth remembering. Chloramphenicol is avoided if you have a personal or family history of aplastic anemia, and avoided in late pregnancy due to grey baby syndrome risk. Steroid antibiotic combos like Tobradex or Maxitrol can make an active bacterial stye worse because the steroid suppresses local immune response. Do not use these on a stye without ophthalmology guidance. Oral ibuprofen is a reasonable option for pain and swelling. Antihistamine or decongestant eye drops have no role in stye treatment. Before we wrap up, here are the questions most people Google at 2 in the morning. Common 2 a.m. searches answered honestly. Stye getting bigger, usually normal in the first 2 to 3 days. Whole eyelid swollen, not just a lump, could be cellulitis. See a doctor today. Lump there for 3 months, probably a Chalazion. GP for steroid injection or referral. Stye burst on its own, that's actually fine. Keep it clean and continue compresses. Can a stye make me go blind? Extremely rare and only if orbital cellulitis goes untreated. Can I drain it with a needle at home? Absolutely not. Why do I keep getting them? Almost always Blepharitis or Demodex. Start the daily lid hygiene routine. One quick safety note. If you have a stye with any red flags, fever, vision changes, eye pain on movement, or spreading facial redness, don't wait. Go to a GP or emergency department the same day. Uncomplicated styes heal at home. Complicated ones don't. The 5 rules to remember. 1. Warm compress 4 times a day, 10 minutes each. 2. No squeezing, no contact lenses, no eye makeup. 3. Antibiotic eye drops are not a cure for uncomplicated styes. 4. 7 to 14 days of consistent home care before you go to the GP. 5. Recurrent styes almost always mean Blepharitis. Fix the root cause. Screenshot any table in this video for later. A quick disclaimer, this content is for education, not medical advice. Always check with your pharmacist or doctor. Full sources are linked in the description below.
If this was helpful, a like and a subscribe goes a long way. It helps more people find clear, reliable pharmacy information. Drop your questions in the comments. See you in the next one.